Welcome back, everyone. Great guest today, Fabian from Illuminodes, who I met over on X, I believe, is when we first touched base when it came to Nostr. And so Fabian's doing some amazing things that I really want to talk about today. So Fabian, welcome to the show.
Thank you very much, Joe.
Yeah, no problem. Glad you can make it all the way from El Salvador, correct?
Yep. We made the move probably over a year ago now from Australia, and we're loving it. Absolutely.
Fantastic. I still have to make my way down to El Salvador. I think you've talked to Sandy, and I think Sandy is the one who kind of helped us link up. Amazing person, and really enjoyed talking to her. So I'm glad she also was part of this connection here. So Fabian, just tell us a little bit about yourself and who you are, what you do.
Okay. I'm a technology, I guess, business person, business owner. I've been in the internet game for decades, really. So I mean, as a kid, I was like, building computers and probably one of the first on the World Wide Web sort of thing. I remember making long distance phone calls and my parents getting big bills because I wanted to experience long distance World Wide Web experience. So yeah, been in the game for a while, I guess. So like the local nerd, the local community, local neighborhood nerd. So yes, I've been around for a long time, been in the internet game for a long time. Also been very much focused on self-sovereignty, freedom. I always sort of highlight the fact that for years in my bedroom I had the word freedom hanging over my bed. So every time I entered that room, it was like freedom, freedom. But yeah, I think it's not necessarily about freedom per se, but it's the right and the ability to make your own choices. And that has always been sort of very behind my decision making. And here we are in El Salvador. El Salvador seems to be on the path of self-sovereignty and of freedom. And certainly with some of the tweets that Bukele, their president over here, has put out, in response to things like Telegram and Rumble recently. Yeah, this country seems to be on that sort of path that I believe in as well. And as a result, we've moved over here and we're building stuff. And obviously, one of the things that we're doing is building with Illuminodes. So there you go.
Yeah, no, it's amazing, and yeah, they're obviously in the Bitcoin community. I think we've all been a little bit more aware than maybe the rest of the world of what's going on in El Salvador, and it's really great to see the growth. And obviously, it's become something that everyone's talking about now. You see so many people moving there to build, to grow, and it's getting a lot of press. And so it's very interesting, and I'm looking forward to seeing, hopefully firsthand, what that's like, and maybe pay a visit maybe this coming spring. I think that'd be fantastic.
You should,
But
man. You should. Absolutely.
definitely.
It's the amount of excitement, hope that is here is just tremendous. I mean, last weekend we celebrated the 3rd-year anniversary of the Bitcoin law.
Yeah.
And I mean, the amount of people and connections that you make of all these people that just want to build and create is tremendous. Like I mentioned before, I mean, before this I was in Australia, and it's just a lot tougher. And I think that sense of hope is definitely not like it is over here. So pretty exciting times here.
That's great. That's great. Well, one of the big reasons that I was looking forward to talking today is what you're doing with healthcare in Nostr. Just some background about me. I think I've talked to you about it over WhatsApp or something. Majority of my family has been involved in healthcare in one way or another, whether it's as a provider or as an administrator, or to include even insurance.
Yeah.
It's runs pretty deep in my family, and so whenever I found out you were using Nostr for, I think it's a pilot program for healthcare records, I thought that was very interesting. But so for those who are not familiar with Nostr or anything like that, can you just kind of give an overview of what Nostr is and kind of how it's applying to what you're doing?
Yeah, I mean, I think the easiest way to explain is that Nostr is about transmitting messages or information, because any message can contain information, right?
Mm-hmm.
And that information can be transmitted with a key pair, just like you have, a set of keys, your public and private keys for, say, your Bitcoin, right?
Mm-hmm.
So, in essence, if you think about it, every single transaction or every single thing that we do is, in essence, a message that's being transmitted. Right now, we're transmitting information, right?
Mm-hmm.
Transmitting messages, transmitting information. So the only difference is that with Nostr, that is actually tied up with a key pair. So what that means is that when I transfer or transmit a message or a bit of information, and I own those keys, that means that I actually control the message and the content, and I can verify that that message and that content is mine because I own the keys. So all of a sudden, we live in a world where, right now, it's like when I say, for instance, need to log into some sort of, I guess, service,
Mm-hmm.
be it a social media service. I basically put my password in. That password goes to the service. The service then says, yes, you are allowed to actually use our service. And then that comes back again. I don't have to do that with Nostr. With Nostr, it's actually, hey, I'm here. I own the keys. I keep those keys on my device. So I never actually share those keys out in the world. I can control them. I own them. And as I said, so you've got that public-private key pair, just like Nostr, or sorry, just like Bitcoin. As a result, the message is verifiably honest, truthful. As a result, that message cannot be changed, right? And as a result, I, in essence, control the data that I'm sending. That then starts to work into things like health information. Right now, if I have health information, let's say I go to the doctor, I say, my name is Joe Bloggs, and the doctor goes, Joe Bloggs. He's got a lot of information, probably 10 Joe Bloggs is here, but he clicks on one of them, right, and looks it up and says, oh, Joe, this, and then maybe give you some, drugs or whatever it is. And then 6 months later, you're all sick and stuff like that. And it turns out that it was the wrong Joe Bloggs. Now, if I actually own and control, again, my identity and my health information, I can go to the doctor and the doctor says, so you're Joe Bloggs. Yeah, which one? Well, actually, you don't even need to know that. I own my identity. I own my health identity. And therefore, I can own my health information and I can release that to the doctor. So the doctor actually knows that this is the right Joe Bloggs with the right health information, etc. But like I said, right now the world doesn't work like that. The software companies, the big database companies, they are the ones that actually own your health information. And I mean, as you said, your family's been in the health industry, so you would know this quite well.
Mm-hmm.
I actually need to go to the doctor to find out what my health information is, which is a
Yes.
little bit back to front because it's mine, really. And it's my identity and my information. So I guess what we're trying to do is flip the world upside down. Because, yeah, having been in the software industry and actually having a company in the health administration side, in the traditional methods of, the cloud-based stuff like that, I know how easy it is to just take that information that is there and change it, do whatever I want with it, sell it if I want to. I mean,
Mm-hmm.
it's it's a bit bad. So in other words, we're basically, throwing this upside down and giving the ownership of their health identity and their health information back to the individual, back to the patient, back to me, you, etc. Does that explain it?
Yeah, no, I think it's fascinating. From a personal experience, whenever I had an MRI, probably about 2 years ago, maybe,
Yeah.
and so I went. So I had the MRI, waited a couple days, and we happened to be in the same area, so I wanted to stop in and get my results. And the place would not give me my own results. They said I had to go to my primary care provider to receive my results. I was like, but this is mine, and like I said, I have uh, medical professionals in the family who, if like when I show them the results, they're able to interpret what is written down, or and not that that should matter, but they like I have people who can do that, and so it kind of blew my mind that I couldn't have access to my own medical records, and kind of it
Yep.
was crazy. And then I've had various other appointments at that fell under different type of healthcare systems, whether it's I don't want to name names, but whatever the healthcare systems are. And for each one of those, I had to log on, create a new profile, provide all my personal identification information, and none of those systems talk to each other. And so what I'm envisioning is kind of like Nostr for social media, where it doesn't matter if I'm on Primal app or Iris or whatever it is. If I have the access to my public and private key, or really just my private key, right? If I say my private key and I put that in there, it doesn't matter what app or what website I'm on. All of my information's there, and it's the same whether it's on Primal, whether it's on Damus, whether it's on Iris, and it's there. There's no, I don't have to have all of my information spread across
No,
10,000 different networks to make this work.
correct.
That
So you sort of highlighted a couple of cool things there. One is you've clearly highlighted that all these different institutions, they have, you know, your health
mhm,
information, and they can do whatever they want, and it's a different organization, different health information, etc., etc. The second thing that you highlighted was the fact that through Nostr, what you can do is you can create yourself a digital identity. And a digital identity is quite relevant today. I mean, I always make the comparison that for hundreds and hundreds and hundreds of years, or thousands of years, I guess ever since humanity existed, we lived in a physical world where I could, go somewhere, do something. If I didn't like that place or didn't like the people from that place, I could literally stand up, walk away, and go somewhere else. In today's world, we actually sort of have a hybrid identity. We live in the physical world, but we also lived in the digital world. Now, the digital world has not given us the opportunity yet until now, right? Where we can basically do exactly the same. Say, okay, I don't like it here. I'm going to take my digital identity away from this hospital, from this library, from this government, from this whatever it is. So, in other words, all of a sudden we have that digital hybrid world that we live in. We have that ability to walk away and say, you know what, from here on in, you guys at the hospital or you guys are somewhere else, I don't want to deal with you. I'm taking my identity away. See you later. I'm going somewhere else. We haven't been able to do that in the past. I mean, the internet's been around for quite a long time. What, 70, you say, right?
mhm,
So um, that's up to now hasn't been possible, and that's what the Nostr protocol is doing. So what we're doing is we're saying, okay, well, great, Nostr protocol, Bitcoin, all this wonderful, key pair scenario, personal identity, digital identity scenario. How about we build a protocol around health, and we call this the Salute protocol. And that Salute protocol is basically to manage your health identity, your health information. And then on top of that, we integrate it with global standards. Like, I don't know if you ever heard of things like HL7 or FIRE standards, which is
okay,
like a global standard of transmitting health information. So we integrate that into the Nostr messaging that we're actually, working with. And that is what we're defining as the Salute protocol. And the beauty is that we found in El Salvador a hospital that takes all that theory that we built and all that back end architecture that we built, and now with them running this pilot to actually make it real world. And so this is Para Vida Hospital. So they're Salvadoran hospital, private hospital, very well known over here, and an organization that loves innovation, that loves to be on the forefront. And yeah, we're working with them and slowly deploying this technology, this Salute protocol, and hopefully changing the world. I mean, can you imagine what it would be like if we could actually own our own health identities and health information instead of what you've gone through. This is ridiculous. There's
Yeah.
actually there's actually a guy, a friend of mine. He the first time I told him about this, he had to think of a scene in a movie called Roadhouse. Ever heard of that?
Yes. Yes.
The old Roadhouse.
Like not the new one with Jake Gyllenhaal.
No, not the new one, the old one.
With Patrick
So
Swayze. Yeah.
yeah, exactly that one, where Patrick Swayze literally has a physical folder of his health information and says, "Here, this is my health information," and the doctor says, "Okay, well, let me have a look at it." And then he just takes his physical folder of health information, takes that away again. It's not in the system, it's not in everything, right? But he controls his health information. And now we're doing that in a digital way with the Salute protocol.
Yeah. I really do think it's fascinating. I guess I would ask what were, or did you have any challenges in, because we're talking health records, right? And that information. What challenges, if any, did you face getting the hospital to undertake the pilot program? Because I'm sure was some hesitation because of the health records and privacy on a relatively new idea. What was that like trying to sell them on that?
Yeah. As I said, I think they're very forward thinking. I also think, and this is probably sort of like Bitcoin. If you think about it, when did Bitcoin come out? Was straight after the global financial crisis, the
Mm-hmm.
2008 global financial crisis. Why?
Yep.
Because people all of a sudden realized that the financial system is broken. And therefore, having experienced that, seen that crash, people are going, okay, yeah, there's something going on here, and we need to sort of find a solution. As a result, Bitcoin came out.
Mm-hmm.
I also believe that the same thing applies to identities, digital identities, and health. I don't know if you've experienced that crazy time that we've had in the last 5 years around the world about health and digital identities and
Mm-hmm.
privacy and stuff like that.
Yep.
And I think that just like Bitcoin with the global financial crisis has awoken people's openness towards saying, hey, this is not working. I don't control my own identity. They're making me do things that I don't want to be part of. So that I think has fueled the fact that we can do this now. Would this have happened, or would this have, well, first of all, Nostr didn't exist, but would this have been possible, and would people be open to the idea 5 years ago? Probably not. So I think we needed that big, crazy wake up call that we got around the world with this, COVID thing and vaccine thing and all that says, okay, yeah, I think they're sort of going a little bit too far, and I'd like to take back control. Now we have the technology, now we have the mindset, and I think the hospital is the same thing. The good thing, though, about the hospital is that, as I said to you before, we can have all these wonderful architectures and everything in place behind the scenes. That doesn't mean, though, that it's going to work like that in the real world. And we're just very, very fortunate that as people actually understand what's happened, understand the digital identity issue, and are willing to go on that ride with us where we're saying, okay, well, we're building this new protocol. We need to deploy it. And are you open to having to figure out how to work with patients, how to work with doctors, how to work with pathology, how to work with all that information? Because yes, now it exists. Now we need to make it real world. Now we need to make it available and usable for the day-to-day patient who doesn't really care. They just want to go to hospital and get their stuff sorted out, and then realizing at the same time that, hey, they actually control their own information. What an idea! What an idea!
Yeah. No, it is something that it kind of. I do remember the days of the even as when I was younger, right? If you switched primary care when I was a kid, you had your packet of your data, or if you went to the dentist or whatever, there was your X-rays and everything else in the hard copy, and you took that and you physically handed it to the next location. Yeah,
Yeah.
I mean, I guess I'm curious. And you mentioned it something about, and this is beyond my, definitely above what I understand, but the different, I guess, security parameters for sending health information, because that was also something I was wondering about. Now, here in the U.S., you have a HIPAA, the Healthcare Information Privacy Act. I was curious, how do you, did you apply that, or how did you, is that standard across? I mean, or I guess, is it standard in El Salvador, what you're doing, or is there different, whatever country you're in, there's different levels of regulation on what you can and can't do with health information?
So look, obviously from a legality perspective, I think we're going to go through the same sort of again thing as Bitcoin.
Hmm.
I mean, we're this is disruptive. We make this work. This is going to be disruptive because right now the way this stuff works in the world is, like I said, big centralized data warehouses, database companies, software companies, etc. So that's definitely something that I'm going to see. I would see as we move along. Um, Standardize wise, El Salvador is sort of in a crazy but awesome position that a lot is still very manual here. So standards and stuff like that. Sure, there's laws and stuff like that that people need to follow, but the standards are not really there in place that much. So, and the other thing is it's extremely manual here. So, hospital systems, but other systems as well is very, very manual. So they're almost in a position that now, if when we roll this out, this is sort of like, okay, we're going to leapfrog the Western world, right? With this whole new technology, with this, decentralized technology. Um, and that's obviously a bonus. One of the things that, for instance, as I said earlier, that is existing in the world is this HL7 FHIR standard, which is
Hmm.
funny enough developed in Australia about, I don't know, came up in Australia about 25, 20 years ago, which is a way of actually um, describing health information in when you transmit it. So in other words, there's a sort of standardized way in how a blood test result is communicated. And what we're doing is we're integrating that into the Salute protocol messaging capability. What that does is basically, whilst using this Salute protocol that we're deploying, is that we're also deploying at the same time this global standard of health messaging and health information messaging. So, in other words, what that means is that if I am in, say, I don't know, Vietnam or something like that, and I'm connecting to relays over here, or the information that I have myself is on my phone, right? All of a sudden, that information is compliant with that global sort of standard. So, in other words, El Salvador, by doing this, is basically lifting itself into this whole new globalized standard that's being rolled out, and primarily in the US and Europe and stuff like that,
Hmm.
with this whole new technology and this whole new method of interacting with identities and data. So that's for them, they go from sort of a very manual environment to the latest and greatest. Uh, I own my own health identity as well as a global standard that I can tap into anywhere in the world. So any software system that actually uses that standard, say in Vietnam, instantly I can then connect to that. The system will be able to read it, and Bob's your uncle.
Awesome. So, what has been the experience for the, obviously, the patients who have, I guess, through the hospital? I mean, having
Yeah.
access to the records like that, have you gotten received feedback from them as well?
No, we're not at that stage just yet.
Okay.
So what we're doing is we're actually rolling this thing out in phases. Um, so phase number one is gone live, I think last week, where we now hospital and doctors are talking to each other with their own identities, et cetera, et cetera. Next phase will probably be where the patient and pathology comes into play. So in other words, as you know, every single visit to a hospital is always going to have some sort of pathology test associated with it. I mean, you don't go anywhere without pathology.
Right.
So the process will be that the patient comes into the hospital, gets a mobile application on their phone, which actually controls their keys. So in other words, they have those keys on their phone, right? They do their pathology test. Test comes out, gets sent to the patient. They control it. They have it on their phone, and there you go. So we're actually trying to make this as seamless as possible. It just means that all of a sudden they come and say, oh, well, I just got my test. Oh, I can control it. Isn't that exciting? They don't care. They've got it here. And then over time, they will learn that they actually control their own health identity all of a sudden, right?
Right.
For the hospital, it just means that they now have a very easy way to interact with the patients. And patient comes to the hospital and says, how are you going? Good. Well, how's your blood test? Patient comes in, releases their blood test to the hospital and say, here we go. That's me. That's truly me. No one else, it's me. I just unlocked it. So yeah, so that's the way that we're seeing that. So over the next year, we'll be deploying different phases of this protocol, and then obviously bringing it to the world with white papers and all that good stuff.
Yeah. No, I mean, as someone, like I said, who's been in this for a while, it really blows my mind, like what this could mean, for, I mean, truthfully, both the individual and then even for, as an administrative side on the hospital side. I mean, like if the patient provides you the key to access their records, right? The doctor has everything, right? I mean, he has all the, so he's not, there's nothing being left out. There's not, well, I never got I have my MRI results from last year, but I also recently had a test, but I wasn't able to get a copy of it because they wouldn't release it to me. And so they have access to everything, that you share with them. I think it could be like a real game changer.
I think this someone actually asked me some time ago about what about the insurance company, because obviously there's institutions need to know information about you to pay out insurance or to do whatever it is. So right now, again, is someone else controls and manages our health information. And there's these massive databases with, say, for instance, an insurance company that's probably got like, I don't know, 100 different fields of information about me and my health situation. An insurance company doesn't need to know 100 bits of information about me to do a payout, right? They might need, I don't know, 10, 15. They don't need to know everything about me, right?
Right.
So in other words, again, the way it's set up now is that they just have absolutely everything about me. I don't control any of that whatsoever. I have no ability to withdraw that, which, of course, once the information's out there, can't unsee it. But I have no ability to say, okay, well, this is the information that you need. You don't need anything else. No, they just take everything. They control everything. They own everything. And as you know, they do with it what they will. And one of them is this information is valuable. This information is extremely valuable. I think in my research, I found that they're expecting by 2030 that health information globally is going to be worth about $2 trillion. That's a lot of freaking money.
Wow.
Now, as a patient, I'm definitely not getting that. Hospitals that just do the tests probably not getting much of that either. But there's massive database companies out there that sell that information. And, we always hear about these wonderful things. Oh, Facebook just sold $150 million worth of your information. Yeah. All right. So that's not fair, of course. So in other words, one of the things that we're doing is we're saying, okay, well, hold on. If I could control my own health information, and if I could control my own health identity and have that identity release the information, one is I know that information is true. So no one actually futzed around with it, right? Because that happens now. I don't know if you know, but statistics, and certainly statistics that people have, they can, play around with Excel spreadsheets and stuff like that.
Oh, yeah.
Yep. So in other words, now I can say, okay, the information that I released is true, is authentic, is mine, is not manipulatable. That's one. So in other words, health information that is now available in the market, if I choose to release it, right, is genuine, is in essence 100% accurate. I don't believe in
Mhm.
100%, but you know what I'm trying to say,
Right.
right?
Right.
So that's one. So then all of a sudden I can say, hey, well, as a patient, would I be open to someone that says, you know what, we'd love to have, some of that health information of these people or this group of people, whatever it is, um, that is in essence 100%, honest, truthful. Would I be willing to pay for that? And then you probably get, drug companies and people and institutions out there that say, yeah, that's valuable information. All right, well, then I have to ask the owner of that information. So all of a sudden, what we're doing is we're flipping that upside down and saying, okay, Mr. Owner, these bits of health fields, those 10 fields of information, we are open to actually paying you 50 cents a month for that. Are you open to that? And then all of a sudden I'm going, hey, I actually own my own health information. I own my
Right.
health identity. And then I can say, no, because I don't like your organization. Okay, cool. Or I can say, yes, I do like your organization and I will release it. So in other words, all of a sudden we're putting the whole thing back to front. The health organizations need to do the right thing because otherwise people are going to say, nah, I'm not interested in releasing that information. So they need to change their ways, their policies, and all that kind of stuff. So all of a sudden people are going to be held accountable because they can't just take everything. They actually have to ask for it and they
Right.
have to potentially even pay for it. So yeah, hopefully, and that's the idea here, that we can literally change the world, and put the ownership back on us, and by being able to do that and release that information, of course, you don't have to have your actual identity attached to it, just bits of fields of information. All of a sudden, these companies have to do the right thing by it. Now, that could be a hospital, that can be a drug company, that can be, I don't like that drug company, so I'm not going to release any information to them. Um, so there you go. So hopefully we can shift that all and put that upside down and create some honesty back in society. That would be nice, wouldn't it?
Worth a shot. I mean, I think it's the beauty of I think what I'm finding here in the last couple of years is, there's always a lot of talk on what we wish things could be or how, it's like, well, Facebook owns your data. There's nothing you can do about it. What do you? But I think now we're shifting to um, people like yourself in the business, your business, which okay, we're done just talking about it. Let's start trying to implement it. And we're going to face hurdles. We're going to face challenges, especially like you said, there's a lot of money involved with information, right? So I'm sure you're going to receive quite a bit of pushback from medical insurance or medical information database companies, right? But if we want the world as we see it in the future and protect our information and not fall victim to these leaks and everything else, someone's got to do the work. And so like it's why it's like for me it's a real honor to talk to someone like yourself who's not just talking about it and theorizing on what things could be, but actually building and trying to implement change. And then who knows, in a couple years this could be with the growth of this pilot program and adoption within El Salvador, and the next thing you know it catches on and it starts to spark here and then hopefully in the US, and
Yeah,
it
yeah.
becomes the standard, right? Where I mean, because it sounds crazy that you are having to, the idea of you owning your medical records and it being yours to own and yours to keep and not somebody else's, that it's a radical idea seems it seems kind of crazy, but it's the way it is right now.
Well, you've heard of the line, you own nothing and you're happy, right?
Yes.
Yeah, exactly. It doesn't seem that's going to work. Look, I believe that we've sort of globally sort of hit that top of you own nothing and you'll be happy sort of mindset.
Yeah.
I very much believe that we're on a new track where people are starting to realize this about money, about identities, about health, about everything like that, and we're on the right track. I believe El Salvador is literally the epicenter, as I call it, and tell people the epicenter of the new technological and financial paradigm. And that's here. As I said, it's one of the reasons we came over here, because things seem to be sprouting. The new world seems to be sprouting from here, and clearly this country is yet ready. I mean, I don't know if you know anything, but they're working on a new health law as well in El Salvador. So you know, all that seems to be aligning over here, and yeah, I think the world's ready. Like I said to you 5 years ago, no, but now, yeah, the world is ready, and we don't need every single person in the world to actually, get it, or be on this wagon. But
Mhm.
I think, I mean, the book Tipping Point. I don't know if you ever heard of that book,
Mhm.
but I think the number is like 10-12% of the world is what you need to actually make change. And I think that's all we need. It seems to be happening in the Bitcoin world, and I'm sincerely hoping that we can achieve the same thing. And then, once we figured it all out, then obviously this is open source. It's going to be open to the world, and just everyone can just continue to build on this Salute protocol and integrate it with existing technologies, because that's it. It's open. Let's plug it into existing front ends. Let's create businesses around it, and that's our vision. So, yeah, release it to the world. Let the world play with it. Let the world integrate it, and let's take our ownership of health identity back, and the health data back. So, yeah, we're pretty excited, and it's yeah. My vision is hopefully in the year 2050 or something like that, the health half of the world uses this, and we feel that we're in control again.
There you go. I love it. Well, maybe
Yeah,
on my visit to El Salvador, I'll stop by the ER. Just get a
yeah,
quick record.
yeah. It's
But
amazing. I mean, because this specifically, this hospital, they're going down this path. It's an undefined path. They're realizing what's happening in this country, and but they obviously also realizing that there's a world that wants this. There's a world that wants sovereign, self-sovereign money, a world that wants self-sovereign health identities and stuff like that. I think from their perspective, if they play this right, they're going to become a leader. I mean,
for
you've
sure.
seen what's I mean, even Elon Musk is out there. He's sort of relying on the fact that there's people out there that say, you know what, I don't want this traditional way of doing things, but
Mhm.
clearly there's a lot of people out there, and Twitter seems to be working quite well right now. So,
Yeah.
yeah, so I think organizations and entities and people that actually embrace this change, this paradigm change, this paradigm shift, yeah, they can do well. They can make a name for themselves, and in as this all rolls out and as this evolves, as the world moves on.
Awesome. Well, Fabian, we've been talking for about 40 minutes now. Believe it or not, I mean, I could probably talk to you all day about this because this really fascinates me. But I'll definitely post this with all your information, like the Luminodes, your website, your article, which I've tried to share, and not only will I post it on X and YouTube, but I'll post it on Nostr as well.
Sounds like a good idea. Yeah.
All right, Fabian. Well, thank you so much for taking time out of your busy day to talk to me. I'm really fascinated, and I just hope you have a wonderful day.
No worries. And you too. And just make sure that you give us a holler when you're on your way, and we'll have to grab a drink on the sunset
Sounds
here on
great.
the beach.
Looking forward to it. Well, thank you so much, Fabian.
No worries.